Our last stop is in the lower extremity. So we're going to continue that pattern from the level of the ilium and look at all of these major vessels of the thigh and leg. So once again, we have that common iliac trunk. This is for both veins and arteries. If we follow that artery, it's going to split into internal iliac and then external iliac artery. And then, very similar to what we saw in the upper extremity, we are naming based on regions. So this guy here is that head of our femur. We can see the outline here. So once we get to the level of the femur, this is going to be our femoral artery. Pretty straightforward. There is also a deep femoral artery. So what we see here is this branch splitting off and then it's diving deep, kind of past the femur. Don't worry about that. We're just focused on our superficial continuous vessel here. So this is all femoral artery. And then something interesting happens. So on our model here, notice that we are no longer in anatomical position on this right side. So I'm actually going to readjust here so you can see that. So right side here is an anatomical position. This left side, I think I misspoke earlier, left side is a little laterally rotated. And that allows us to see how this vessel continues behind the knee. So the femoral artery is going. When we get to the level of our knee joint, it wraps behind the knee. And this is called our popliteal artery. It may help to think about the popliteus, that muscle that we looked at that sits behind the knee and helps to unlock it during leg extension. This is in the same area, so it's called the popliteal artery. And then our popliteal artery, we're still continuing, one continuous vessel here. Popliteal artery is going to split off into an anterior tibial and a posterior tibial artery. They're named directionally. We're at the level of the tibia now. This is all making sense, hopefully. So the anterior tibial artery is going to be this more anterior branch. Remember, this is no longer anatomical position. We've got a posterior side and an anterior side that we can see. So this little guy here is going to be our anterior tibial artery, and then this is a continuation of that posterior tibial artery. If you get mixed up by that, go ahead, follow the vessels down and see if they're on the posterior foot or the anterior foot. So this is our heel bone. This is more posterior. Toes are going to be more anterior. So we can also see a little bit of anterior tibial artery down here, popping back out again. And that's it for lower extremities. There are just a couple exceptions with veins that I want to look at. So overall, we're going to follow the arteries. There's going to be veins of the same name for all of these structures we looked at. When we get to the level of the knee, we've got just a bunch of tibial veins. We don't really name them directionally. But overall, that pattern is going to stand. But we also have some unique veins. So we have two saphenous veins. That's saphenous. These are going to be starting in the thigh. And so we're going to have a great saphenous vein more medially, and then we're going to have a small saphenous vein more laterally. And they're named based on their length. So great saphenous is actually going to start pretty high here. It's going to start at this level, and then the most medial vein that we see here running all the way down to our ankle and our foot, this is all great saphenous vein. So it's like one of the longest veins in the body. Makes it easy to identify. Small saphenous is a little trickier, so it's actually good to start at the foot. We're back in anatomical position here, so this is the front of the foot, that dorsum that we can see. So we've got great saphenous. There's going to be a little connection here, the venous arch, and then we're going to come back up the other side as the small saphenous vein, sometimes called the lesser saphenous vein. And those are really the only different veins that we see here, the only ones that break that naming pattern. So I want you to be comfortable following arteries and veins down from where they split off at the external iliac artery and vein. So you can use either side of the model for the veins or the arteries. And then do note that we've got those two exceptions here. We've got great saphenous and then small saphenous vein.